You lovelies are ready.
We're good.
Great.
Okay. Ready? 3, 2, 1. Welcome to this episode of the Montpelier Happy Hour here on WVEW LP Brattleboro, your community radio station, as well as BCTV. I am your host, Olga Peters, and I have on the show with me today regular contributor Emilie Kornheiser. Hey, Emilie.
Hi, Olga.
And Commissioner of the Department of Financial Regulation, Mike Pieciak. Hey, Mike.
Hi, Olga. How are you?
Good. So glad to have both of you here because this is really a good time to talk about how things in Montpelier are shaking out for Windham County. And for those who don't know, Mike and his department, or maybe I should say Michael or Commissioner or
either any title.
Any of them works. His department has been gathering a lot of the data needed to model and forecast how COVID is playing out in our communities, and has been integral to the kind of the reopening process that the governor is announcing day by day at his press conferences. So, hey, Mike, thanks for making the time to be here.
Yeah,
and
my pleasure.
Let's talk about, as Emilie put it so beautifully before the show, what are some of the long-term plans for reopening and the dynamics as we open our society about COVID and folks who are having a hard time adjusting as we reopen or want to reopen faster?
Yeah.
Yeah, please go with that, Mike.
So, it's a great question because it just gets right at the heart of the challenge here. I mean, the governor has said, and I think he's right, that in some ways it was easier to close everything down than it is to reopen, because when you're closing it down, you're pretty much just thinking about the health policy aspect, the health consequences. And when you're talking about reopening, you're certainly talking about those health consequences as well, but you're balancing that against the economic consequences and even I'd call it the non-COVID related health consequences. So the longer that we remain in shutdown, the more people are putting off routine visits to their doctor, the more people are delaying what would be routine medical procedures that might become more complicated over time. And even the mental health. I mean, this is Mental Health Awareness Month, and you think of people not having that personal, intimate sort of relationship with their friends and their family in ways that they usually do, and particularly in times of great stress. I mean, the time when you need it the most, we all have to be distant and isolated. So all of those things.
There's also the people who are trapped in situations that are terrible for their mental health, who can't get out of it right now, who don't have those extra supports. So, domestic
Absolutely.
violence, family violence is,
lots
of health consequences of us staying trapped in our houses.
You can think of children that, school was a refuge for them, and now, they're trapped at home. So it really has it's not just economy versus health. I mean, it's sort of economy and health versus the COVID-19 crisis, right? I mean, it's just sort of this unique balancing act. So I think it's quite clear that the governor's policy has been to take at the appropriate time. The first thing we wanted to make sure is that we had the virus under control in Vermont. We didn't want to act too quickly to start reopening the state before the virus was contained and on a good trajectory. The White House put out guidance that said states should see like a 14-day decline in new cases or a 14-day decline in the percent of positive cases. In Vermont, we've really been seeing trends down for almost 30 days. So we're well beyond sort of the federal guidelines that have come out. We think that we're very well positioned compared to the rest of the country to reopen. The one concern really that's somewhat unique to us because of our small geography in New England and the Northeast is the fact that although we're doing so well, some of our neighbors are not doing as well. You look at New Hampshire, particularly southern New Hampshire, they are continuing to see a lot of cases. They had, I think, over 100 cases today reported. You look at Massachusetts and you look at downstate New York, but even in the Albany area as well. They're just not faring as well as Vermont. So you do worry about sort of the reintroduction of the virus into our state, both in the short and long term. So that's something that we have to keep an eye on. But in terms of reopening, we certainly have met these metrics and these markers. And then the question is, how do you do it strategically and slowly. And one of the guiding principles has really been to take small steps. As the governor says, turn the dial, ever so slightly, because we want to have time to respond or slow down if the numbers change and the data changes. So just to give you a sense of how complex or maybe complicated this is, you're probably familiar with the fact that, if any of us on the video were to get COVID-19 today or be exposed to it, we likely wouldn't have a confirmed test telling us that we have COVID until 14 days from now. We would have a period where we didn't have any symptoms as the onset. We'd have a period of time where we started not feeling so well. We'd have a period of time where we started feeling worse, assuming that we were not asymptomatic. And by the time we went to the doctor or the hospital and the 2 or 3 days it takes to get the test back, that's 14 days later. So the thing that you don't want to have happen is to get away from you quickly, because we won't know. All of our markers are not sort of markers that we will know tomorrow. They're markers that we're going to know 2 weeks from now. So we can't let it get away from us in the interim before sort of our first warning flags come up and tell us, hey, this is sort of a train rolling out of control. You need to really do it in slow, measured steps. So when those 14 days have passed, you can take a look at the data and say, we had negligible impacts or we had slight impacts, but those are manageable. And then again, when you're talking about reopening, ultimately the thing we're concerned about is making sure people have hospital resources that they need, whether those are hospital beds or ICU beds. And again, there's a delay there. So it takes us 14 days to get our test result back. But you can tack on an additional 7 days until we might need hospital care, if we're going to need hospital care. So that altogether, that's a 21-day delay between when transmission would happen and when someone might need a critical care bed. So that's why, yeah.
2 questions about that.
Yeah, of course.
One is, I'm really curious about the skill set that you and your department brings to this modeling exercise, because you're not the Department of Health, you're the Department of Financial Regulation. And yet you're speaking about this with like a lot of sort of certainty, authority, and I trust what you're saying. And so I'd love to hear more about sort of the parallels between the kind of skills that you all have and that you've brought to this work. And then, start there.
Yeah, for sure. I'd be happy to. So, if you think about what we do at the department, we really are protecting consumers. And how do we protect the consumers? We are ensuring that the companies are financially solvent. We only do that work of financial solvency by projecting out, their financial, returns and their financial impacts. So sort of that financial modeling. But we also have to model out, sort of this actuarial modeling. So if you're a life insurance company and you're making promises today that you're going to pay someone on a policy maybe 50 years from now, we have to sort of do that modeling both on the financial side and also on the life and health side to determine whether policies are appropriately priced, whether the company has appropriate reserves, whether they're, in a strong position to make good on those promises. So, I've been impressed by our team here at the department because they have, we're not epidemiologists, we don't have that background or that skill set, but they've been able to adapt quite quickly with their sort of actuarial mindset and their financial mindset to the world of health. And of course, we also have to rely on experts as well. We are working with primarily four outside experts outside of the state of Vermont that are experts in infectious disease and modeling. So they really help fill in the blanks for us when it comes to all things epidemiological and medical and health. So that's a critical component as well.
Thanks. And then when these small steps, which it makes a lot of sense to me that you would take a small step, open the door a little bit, and then, wait 15 days to see the effects and then make another decision. And I'm comfortable with that. And then I also see a lot of people, information is flowing very strangely right now.
That's true.
There's so much of it. And finding trusted sources seems to be both easier and harder for people. And uncertainty and fear are, incredibly heightened. And so I think trust is more complicated than, any other time. And so I worry, and I'm seeing already, that these small steps and the particular ways that they're being communicated, either in the initial press conference in sort of political speak, or the way those then echo out, causes some confusion.
Yep.
So like what actually, you know, this next step, like, okay, golf courses, that's really clear. But beyond golf courses, and I know that, you know, our auditor is like super psyched that golf courses are reopening. A lot of other people who are too. But like beyond that, what's the difference between what we're being sort of, what's now available to us socially around this idea, like we're allowed to congregate, but we're still wearing masks. Are we still wearing masks? We're still staying 6 feet apart. How is it even different from what we were doing before? So I think like what to actually do is still confusing to people.
Yeah. And I think that's totally understandable because there are, you know, when you do small steps and you try to have broad-based policies, there are always examples that sort of don't make sense for the policy, right? You know, I can be safe in this example and that doesn't fit the policy. Why don't we have that exemption, you know, and you can go on from there. So it does become complicated. And I totally appreciate that from like every Vermonter's perspective, because I appreciate that as well. How does it really, you know, how does it really change, and how should people be thinking about, you know, these requirements? I think the broadest picture, people should anticipate, you know, the protocols around mask wearing, protocols around physical distancing, not necessarily all being in our homes, but even when we're together and in public places, to have physical distance between us. You know, that people should expect that those kind of protocols will stay in place for some time, regardless of what the specific rules are around whether you can go into a retail store or whether you can get your hair cut. So those are examples of things that are likely to be here for the long term. Let's just call the long term the next few months. Similarly, hygiene around, you know, washing your hands and not touching your eyes and your face and your nose and such are going to be good practice forever, but they're particularly going to be good practice, you know, for the next, again, long-term next few months. So those are big picture things that like people are going to be expected to continue to do, whether they are, again, going to the grocery store, going back to their workplace where there's a lot of people in their workplace, or whether they're, you know, if they can't socially distance themselves when they're out for a walk. Usually in Vermont, we don't have a problem with that, obviously, but people should be mindful of that. When it comes to other big things that will likely be restricted, at least in the medium term, you know, big gatherings, you know, gatherings that we're all used to in the summertime, you know, things like, I mean, just even the farmers markets, I mean, they're open, or they're open in a different way, but they're not the farmers markets that we all think of in Brattleboro or elsewhere. Graduations is one, you know, that's going to be tough. You know, that's going to be almost impossible to have a graduation where a lot of people, even if you're outside, to have that many people together in a single space. Similarly, all the festivals that we have over the summer, whether that's, you know, the Brewers Festival, or whether it is, you know, all of the fairs that we have across Vermont, those things are going to be really challenging, those large group events, even as we reopen, because, you know, that's just an opportunity for a lot of people from a lot of different areas across a region or across a state to come into contact with each other while the virus is still present in our community and we don't have a treatment and we don't have a vaccine.
And so you're still thinking about those sort of cross-community vectors when you think of those?
Yeah, exactly right.
Okay.
Because it can, you know, part of the issue is you have you have folks that are symptomatic, but then we don't even know how many people are asymptomatic, but we do know that those folks that are asymptomatic can, you know, shed the virus to other people. Mm-hmm. So again, when you have a lot of people coming together and then going out to a lot of other different, you know, coming together, then going out, whether that's through travel, whether that's through fairs, whether that's mm-hmm. through weddings or graduations, it just causes concern because it can sort of light a fire in one place and then spread it like wildfire to many different places. And then, you know, all of a sudden the ramped up testing that we're planning to do, the contact tracing that we're planning to do won't be able to control, you know, and contain the virus in and over the summer. And that's really the goal, is to continue to have these small reopenings while increasing testing, increasing contact tracing, continuing to do sort of these policies that reduce the transmission or the likelihood of transmission, so that we can get back to a more normal state. Definitely not normal, because we just talked about things that will be restrictions for a while, but a more normal state while maintaining containment of the virus. So it's a tricky balance, and I think it'll become, all of these rules will become clearer once we get to a place basically where non-essential businesses can open again. Basically, people can go back to work. People can go back to shopping at retail, getting haircuts, maybe differently. Maybe the retail has to be done differently, and you get your haircut in a different way.
You mentioned haircuts a number of times, and I know our listeners
I think it's because I
want to
need
know,
one.
are you about to announce that haircuts are going to be allowed again soon?
No, it's just I need one so badly. I keep thinking about it.
So we don't have a definite date on the haircuts.
Shucks.
But haircuts is one where you think, haircuts and dentists.
It's a really hard one.
Yeah, they're just close contact.
Very close contact, yeah.
So those are ones that come to mind when you think of this sort of, non-essential, but, so those are, I think, again, once more things are open, once there are less sort of restrictions and protocols that are very specific, I think it'll become easier for people to understand the new reality for a little while here. But again, I think you can think of those broad-based items that are going to remain, the mask wearing and such, and washing your hands with frequency, and being physically 6 feet apart from folks when you're in a park or when you're at a movie theater or something like that. So challenging, but certainly Vermonters have shown an ability and a resiliency to be able to do this for the last 10 weeks or so.
Let's talk quickly, if you don't mind, about some of these protocols, because I seem to remember it was either last week or the week before, in the conversation with the governor at one of his press conferences, someone had called something a requirement, and I don't remember what it was, but the governor says, like, oh, no, that was not a requirement. That was a restriction or a suggestion or something like that. And I think that is adding to some of people's confusion too. They're like, am I required by law to stand 6 feet apart, or required by law to wear a mask, or is this my own free will? Could you just kind of parse that out a little bit for us?
Yeah, for sure. And I if I remember correctly, the question was about sort of closing businesses maybe. And I think the governor might have said, I didn't close any businesses or something along those lines. And I think what he was getting at was that, he didn't say, he didn't mandate you have to close, but he mandated you can't do business in the same way. And for some businesses that meant they had to close. I mean, for barbers and dentists and other things, they couldn't do their work in a different way that complied with physical distancing guidelines. For others like retail, oh, go ahead, sorry.
One thing I really appreciate about, as things have been reopened, the guidance from VOSHA has gotten so much clearer and more articulate. And I think that brings a lot of comfort to workers who are really confused about where their rights were and where their expectations should be of their employers. And so that added layer of clarity in this sort of more uncertain time as we reopen, I think has been really powerful.
Yeah, it's important. It's a critical piece, and employers are supposed to have their own plan about how are they going to follow these requirements and how are they going to keep their employees safe. And employees should be asking for those if they want to see them, because that's a piece of this as well. As employers might want to go back to work, or they might have some anxiety themselves about going back to work, and employees might be also at the same time anxious to go back to work, but also having some extreme concern about going back to work, particularly if they're in an age category that puts them at higher risk, and particularly if they have an underlying condition, right? So all the more so that those folks, unfortunately, are really in this bind about life and health, life and death, and sort of economic and health choices. So, it's good. We need to do everything we can to make sure the workplaces are safe when they open up, and that's both the employer, having a plan, but it's also all of us who are going to go to a retail location, go to the grocery store, or other places to make sure we're wearing masks and complying with those kind of recommendations, because we need to do our part to help keep those folks that are on the front line safe as well.
That's something else that I think Olga, do you want to?
I just want to quickly, before we forget, to remind people, Mike, mask wearing and standing 6 feet apart, is it a requirement or a recommendation?
So it's a good question. So the governor has not mandated mask wearing. There are states that have, New York and Massachusetts have mandated it. They are recommendations, and similarly with physical distancing, recommendations as well. I think that largely takes care of the problem. I think likely if we mandated it, the same small percentage of people that are not wearing masks now or are not being physically distant I don't know if that would change their minds, in all honesty. So I think you probably get the same effect by this approach as you would a mandate. And I guess the one difference, to your point, is enforcement. What does that mean on the enforcement side? And I think practically it'd be pretty difficult to envision a scenario where we're asking the state police or local police departments to issue citations or things even more severe for people that aren't wearing masks in public. And again, I mean, you could be, all of us could be taking a hike in the woods and we don't really need to be wearing a mask. But again, if we're going into the Brattleboro Co-op, we all should be wearing a mask. So there's even some, room for some room for, you could be walking down the sidewalk and turning left and going on a hike, or walking down the sidewalk and turning right and going to the co-op. So a police officer, it's hard to enforce it. And that's why it kind of comes down to some level of self-policing and common sense.
So towards self-policing and the Brattleboro Co-op and all of that, I don't think, I'm uncomfortable with the idea of making this a legal mandate.
Yep.
And I think the degree of uncertainty that comes from a recommendation creates an environment, particularly in our special corner of Vermont, but I think probably in a lot of other corners of Vermont, where, folks who have uncertainty or fear or discomfort or cognitive dissonance or whatever we want to call it, one sort of go-to emotional state from that is righteousness, right? And
right.
Righteousness and fear. And so what we see, what might have once been sort of tone policing, is now physical policing around people wearing masks. There was an article in 7 Days that I did not read. I just read the headline. I will own that. Although also just read the headline. But
No, I read the whole thing.
The article? Okay, sorry. Last time we talked to you, about, people sort of calling in to make reports.
Oh, right.
About other people's behavior. And I'm seeing a lot of sort of that happening on social media. Is this business doing well enough? Are the customers in this establishment being sort of good citizens or good community members? I see some people saying, like, I wear a mask because I care about you. And what I get concerned about in that mental frame, which is very easy to fall into, very easy to be in, and it's sort of those social norms are what tie us together generally, is that for some members of our community, they like the mental flexibility to pay attention to what's going on, to adapt that quickly, to get a mask, all of it is just like not available on a day-to-day basis.
Yeah.
And I want to find a way that we can navigate this new normal with people feeling clear about expectations while still everyone feeling sort of safe and open in their communities with each other. I don't know what the appropriate policies are to achieve that.
Yeah, it's hard because when you're describing the scenario that you're talking about, I think of, maybe, I think about how quickly all of this has changed. I'll just put it that way. I think about mid to late March when we were doing, the governor is doing a 3-day-a-week press conference, and I only participate once a week. But I remember basically between one Friday and then the next Monday thinking, boy, the governor's going to wear a mask. And we hadn't decided on wearing masks yet, but I think to myself, boy, we're all going to wear a mask up there. That's going to look interesting. Like, that's going to be kind of weird. Like, how's that going to play? And then I think that Friday night, I saw the governor of Colorado wearing a mask at his press conference. And then for me, it changed immediately. Seeing one leader step up and do that. It was like, by Monday, we would have looked silly not wearing masks or whatever the timeline was. So that's just one example of how quickly like our sort of our framework can shift. But to your point, not everybody is on that same timeline, and they might not be as keyed in to everything that's going on. Even the people that feel self-righteous might have some level of ignorance going on as well about everyone's personal situation. Some people have conditions where they can't, breathing conditions, they can't wear a mask. It's not sort of something that is safe or healthy for them to do. So I think we all, it's a tough balance, but we have to sort of try not to judge and try to put ourselves in the other person's shoes and try to, like we always do, it's always good practice to try to look for the best in the person and think that they have the best intentions before we assume the worst in them and assume that they have the worst intentions.
And really, take care of ourselves and our own responsibility for ourselves. Yeah. But I have a lot of compassion for the uncertainty that leaves people and leads people towards that righteousness too.
Absolutely.
And then sort of there's the concurrent uncertainty that leads people to say, who cares? Like, I have no idea. I don't understand it. Who cares? I'm not going to deal with it.
Yeah. Too complicated.
Too complicated. Yeah.
And I appreciate that point of view as well, because it is very complicated, and it's, and all of these rules and directives and orders are all being layered on top of the fact that, again, we're all not with each other in the same way we've been with each other in the past, our friends, our family. We don't have the same social outlets, and we're all living in the middle of a crisis that have never seen in 100 years. I mean, the level of sort of anxiety and fear and concern that is just part of our daily lives now, that I think we all just accept and don't even realize anymore, is having an impact on us as well. Yeah. So we have to live with all of that and then try to figure out a complex web of rules. I get it. It's difficult.
We should break so we can hear from some of our underwriters. But before we do that, I just want to make sure, Emilie and Mike, is there any last minute things you want to add to this segment before we break?
I just sort of want to continue to highlight the idea, which I think we'll echo again in the next segment, about how communicating for a specific audience is so incredibly important if we want people to understand us. And so often sort of like government legal speak or political speak is so different from the language that community members can sort of understand, process, and take things from. And we're, I think so many of us are sort of caught up in our own linguistic circles. And really, the media plays a huge role in sort of reinterpreting that. And we have to find other ways to reinterpret that. We have a sign language interpreter at, press conferences. Maybe we need like a plain language interpreter at press conferences. I don't know. But really making sure that the takeaways for people aren't lost in, the aphorisms and the reassurances.
Thank you for saying that, Emilie. I would echo that in saying, as I'm doing my work as a journalist, I find in this time of uncertainty how important it is to try to make things as tactile as possible, and how hard that can be when there's so much that's still unknown. But that's really kind of what people need so they can kind of hold on to something.
I think that's right.
Thank you, Mike. Thank you, Emilie. And thank you, listeners. We will be right back with the Montpelier Happy Hour on WVEW LP Brattleboro, your community radio station, after hearing from our underwriters. Welcome back to the Montpelier Happy Hour here on WVEW LP Brattleboro, your community radio station. I'm your host, Olga Peters, and if you're just joining us, I'm speaking with regular contributor Emilie Kornheiser, as well as Commissioner of the Department of Financial Regulation, Mike Pieciak. Welcome back to the show, folks. So, Mike, I would like to start with you. I'm curious, what are some of the key metrics that your department has been following as we're reopening the state? What are some of the things you're looking at that could be the red flags that COVID is either hopefully going down, but going back up?
Yeah, so that's obviously a key sort of analysis and a key strategy as we reopen, is to think to ourselves now, before we reopen, what are the things that are going to give us pause if we see this number happen or that number happen or this trend occur. So we've gone through that exercise. We've relied on the Department of Health to obviously come up with many of these metrics, relied on our outside experts to inform that as well. look to our state counterparts also, because other states are thinking about this as well. And we've really landed on 4 key metrics that we will be watching as we reopen and how they trend over the next 2 months, let's call it. One is the number of people that show up into an emergency room or an hospital or urgent care facility with COVID-like symptoms. So when we look back on the pandemic here in Vermont, you could see a pretty clear uptick in people reporting to a hospital or urgent care facility with COVID-like symptoms. At the height, it became about 6% of visits that were to those hospitals or to the urgent care facilities, and it stayed right around that 5 or 6%, for a number of weeks until we started to get down from our peak. So that's an early warning sign for the medical community, because folks are going to show up into a hospital before their test result comes back and tells them that they're COVID positive, unless we get more rapid testing that can be done more quickly. But at this point, that's sort of going to be an early warning trigger that, if we are seeing 4% of visits to a hospital or an urgent care facility report COVID-like symptoms, and it's trending in that upward direction, that's going to be an early warning sign for us that maybe case growth is coming behind that. So that's sort of the second metric, is the case growth. What is the number of new confirmed cases that we're having in Vermont? And since we have a small state with a small population to begin with, and we've been fortunate to have a limited number of cases, our growth rate is a little different than some other states. We could have a situation where we have 20 cases and then a situation where we have 5 cases the next day. So we have to think about that, not necessarily just in a daily growth average, but we want to be thinking about that in a sort of a 3-day average, a 7-day average, even a 14-day average, to get a sense of where we're trending as well. You can see in our case results just this week, there's some variability. We'll have a day where we just have a few, and we'll have a day where it might pop up to 7. And again, all that kind of variability is normal, and we want to try to smooth that out and flatten it out to understand, are we maintaining? Are we slightly increasing, slightly decreasing? So that growth rate is.
How are you going to reconcile that with the increased testing and increased contact tracing?
Mm-hmm.
Yeah, so it's a good question. The increased testing has the likelihood of increasing our numbers, right?
Mm-hmm.
So and the reason it will do that is because, even if the disease generally is trending down in Vermont, if we increase our testing, we're going to be picking up asymptomatic individuals and people with very mild symptoms that wouldn't have gotten the test in March and maybe even in April as well. So we'll just be testing more people. We're going to just uncover more cases. So one of the things that you do to sort of calibrate for that is this sort of third metric that we're looking at, which is the percentage of positive tests that come back. So if you test 100 people and you get 75 confirmed tests, that's really going to give you some pause, because 75% of your cases have come back positive. It really makes you think that you are not testing enough, and you're not testing, enough just generally, but also enough people, that basically there's a lot of disease out there that you have no idea about. If you test 100 people again and you come back with 7 results instead of 75, and that positive percentage is around 7%, then you can have some comfort that you're testing enough people and that the disease is under sort of a containment strategy. The World Health Organization, others have sort of used that benchmark of 10%. So if your confirmed positives are coming back under 10%, that's giving you both an indication that you're testing enough and that you have the virus under containment. When we look back at our own data, we've been under about 10%, generally, but for some volatility for, again, close to 25, if not 30 days. Prior to that timeline, we did have days where we were testing and receiving, 15, 18, 20% positives back in our test results. So that gives you, again, a sense of how, even as we expand testing, how we'll use that metric to help us calibrate going forward. So anything below 8% for us in Vermont, that's not going to be a concern. But again, if we're trending up and get to 8% and get higher than that, that's going to be another one of those red flags for us, certainly. And then, you know, lastly, the fourth data point is really the ultimate data point, which is hospital capacity. So everything we sort of talked about, whether it's flu-like or COVID-like symptoms or flu-like symptoms, whether it's the growth rate in the virus, whether it's the percentage of positive tests that come back, those are all kind of early warning signs building to how many people are going to need hospital care. And we want to make sure that the hospital care is available, obviously, when Vermonters need it, whether it's in a hospital bed, whether it's an ICU bed, whether it's a ventilator. So we have on the capacity side, certainly built up our capacity. We have more ventilators now than we did a number of months ago. We have facilities that are ready to be built out for surge capacity, and those are plans that don't have to be redrawn up. They're sort of there since we had to do this on the way up the curve. So on the capacity side, you know, there's some room for, you know, optimism. How many people will need those facilities? That's the critical question. So we're using sort of a general guardrail that if we get to a 70% capacity, you know, if that's 70% of our ICU or 70% of our normal hospital capacity is occupied, whether COVID or non-COVID related, that's going to be sort of a warning sign for us. And again, the reason that's a warning sign is because of that 14-day and then 7-day, that 21 total day sort of delay between when someone might be exposed and get the virus to when they might need hospital care. It's sort of like slamming on the brakes when you're on ice. You're going to slam on the brakes, but you're going to keep traveling for 21 days with the sort of trajectory that you were on, and then you're going to stop. So you need to build in.
Before?
No.
It's a good one.
I'm writing that one down. Yes.
Save those. This is perhaps a naive question about, you know, the whole flattening the curve paradigm. But let's say we had 100 times the hospital capacity we have now. Would it be okay for 100 times more people to be getting infected? If we had 100 times the hospital capacity, would we not engage in any social distancing measures? Like,
Yeah.
what's an acceptable loss rate for a population? I mean, that's just.
Well, it gets to that. It really
right?
gets to that. It gets to that question because.
Why am I saying loss rate instead of people dying, right? Like, I mean, the whole thing is just dark.
Well, you don't want.
Yeah.
Yeah, it's too dark to put an actual label on it. I think is really part of the issue. But you're absolutely right that no matter if we have every hospital resource that we need, there are still going to be people that pass away from COVID-19. The estimates in the United States now are about 2% for those without an underlying condition, but it's as high as 15% for those that do have an underlying condition. So it is very severe and serious disease for folks with diabetes, with folks with heart conditions, with suppressed immune systems, people that are in their 70s, even in their 60s, and people certainly older than the 70s as well. So there are people that are really at high risk. Part of the sort of reopening strategy is to have those folks continue to have heightened sort of physical distancing standards while others are going back to work, to encourage them to stay home even when others are able to leave their house. And that's really just to protect them against the fact that there's just a greater risk that even with all the appropriate medical care, they might not make it through the virus.
And my understanding is that those folks are still eligible for unemployment, even if their businesses open back up. That was sort of
that's right.
Legislation that we passed in real life, out of committee. And so that I think is really, that detail might have gotten lost somewhere in the mix. And I think it's a really important detail.
For sure, because you could imagine that whether it's someone that's in their 70s and still is working or needs to work, or whether it's someone in their 40s with an underlying medical condition and they have to choose between going back to work and risking their life. I mean, it's really a tough position. So congratulations on passing that.
Thanks. It all feels like just like shots in the dark right now.
Mm-hmm. So I'm curious, Mike, 2 questions. One, I hope is somewhat short, but you know, when you're dealing with small populations like Vermont, I hear this from folks who crunch numbers a lot, that the numbers can skew quickly one way or the other, really easily. So I'm wondering, did you have to build anything into the model to deal with that. But then I'm also wondering, what has looking at these numbers taught us or taught you about Vermont?
I love this
Yeah,
question,
sure.
Olga.
Thank you.
So on the small numbers question, there's a whole industry now called big data, right? And the whole point of big data is that there's a lot of information from a lot of different sources. And when you are able to build a lot of information from a lot of different sources, it can tell you almost anything, and in ways that you didn't anticipate it being able to tell you things. So when you have small numbers, almost the opposite is true, right? You have to be worried that it's telling you a story that's not sort of the actual story. So, how do you guard against that? I think you guard against it by trying to sort of not look at a particular data point or a particular day. You want to look at multiple data points. So, for example, we just laid out 4. If any one of those is sort of wildly off in a given day or a given week, it's not going to give us a cause for concern. It's going to have to sort of be all 4 of those things sort of telling us, danger ahead. You also think about how do you build in, modeling. Basically, you model your experience and build in sort of other examples from other states or other populations that we can sort of rely on. So, for example, our models might dictate sort of the experience that China or Italy had, and then they sort of mimic that for Vermont. So we don't always have to rely on our own data when we're doing modeling. We can sort of rely on a broader, it's not real data. It's sort of, again, modeling and mathematical sort of actuarial assumptions. So you could make some question about that also. But we are able to sort of broaden out, from our own experience. And then we always have to be mindful of basically what's our level of confidence. So there's usually a confidence band in sort of this kind of work. And, if your confidence band is basically the entire spectrum, if we say, anywhere between one person and 629,000 people are going to get the virus, we have 100% confidence that that's right. But that's obviously not a very effective, sort of measurement for us to plan against. So you always have a degree of uncertainty, but you want to get that confidence to a place where we can say, it's likely we're going to have, 1,000 people over the next 3 months get COVID-19, and we have, 70% confidence in that. So it's sort of, again, multiple data points, relying on other states, other countries' experience and their models and their data, and sort of replicating that for Vermont. It's thinking about our data in the aggregate, not any specific day. And I think it's also, again, when you're looking ahead, trying to keep the right perspective about how these are not definitive outcomes that we're talking about, or in the modeling certainly, but also even in the data. We have to put it in perspective about, what's the outcome going to be in a week from now, 2 weeks from now, 3 weeks from now, and not act too quickly or too irrationally.
To put a really sort of more human face on, I think, the story you're telling is that, in Wilmington, Dover area, we had one family where a lot of people got
Right.
sick. A few people passed away. And so this one family's experience changes the data for that whole community, changes the data for that whole county, but doesn't necessarily tell a much broader story about what sort of community infection rates look like.
Yeah.
And we see that same thing, when we look at census data, that we don't want to tell the story of this one small community, because the variation that happens within a small population really can change the percentages wildly.
Oh, for sure.
Schools too, right? We have all those things that happen. This is my momentary plug for everyone to please complete their census forms while we're talking about the census, because we want to be able to have enough data to get an accurate story about what's happening in Vermont and get all of the fabulous federal funding that we need to keep Vermont a vibrant, wonderful place. And now back away from my census plug. Thank you.
Thank you, Emilie. It's a good reminder. I admit I have not done my census yet, so I promise by next week, ask me if I've done my census, and my guilt will be so strong that before next week I will have done it, I'm sure.
What's the timeline? I should know myself, but do we have
it got bumped, actually. in-person census is actually restarting. They're going to be dropping off paperwork door to door starting, I think, next week. And then they're going to run through the fall for the first time.
Yeah, that's what, okay, great.
Yeah. That doesn't mean you shouldn't have completed yours already, though. Because the longer it takes, the more expensive it gets, because they sort of, bump up the processes.
Well, I think why I haven't done mine is for some reason I just had it in my head that I was going to get it in the mail, like in previous years, and so
you will eventually, actually.
I will eventually.
Yes, the longer you wait, you will get it in the mail.
We'll try not to wait for eventually. So, Mike, going back to the numbers and away from my shame around the census, what have the numbers taught you about Vermont?
Yeah, so, Vermont is really a resilient place in many ways. I mean, folks, we're coming out of this from a health perspective better than many other communities across the country. I think Vermonters really did adhere to the social distancing protocols. Our mobility data tells us that people are continuing to stay home still, in large parts. Of course, I'm sure your viewers and listeners will see folks that maybe aren't doing that, as we talked about earlier, but generally Vermonters are compliant with these social distancing measures. So I think that tells a story about
perhaps
the resilience.
Vermonters even prefer social distancing.
That might be right too.
The introvert in me is kind of having a good time, yeah.
So there's a level of resiliency there. There's a level of community there too, right? That there's sort of this, and we all know that, we all recognize that growing up in Vermont, you couldn't do something, in one context and not expect to have a ramification in another context. So you couldn't throw a fit at school and then not expect to see that person sitting next to you at church or something, right? In a small state, in a small town, I think there's that level of accountability and community that we're just sort of inherent in our DNA. And so I think in some ways we just responded to that. This was a call to action from the governor and a call to action from our neighbors. And I think people really understood in Vermont that our individual action was going to determine our collective experience. And we've seen that be the case. It also tells us a story, though, not about Vermonters, but maybe about our systems and our state and some of the issues that we've had sort of in the back burner that, never really needed to be addressed, but then the pandemic has really caused them to be addressed. So think about our rural hospitals and sort of our health care system. Think about the Vermont State Colleges and the challenges that the Vermont State Colleges are facing, particularly with the rural campuses. Think about even the way, something as minor as the way we record our property records and our town clerk and the way that that's managed. Many other states didn't really get phased by that from a sort of a real estate transaction standpoint, because everything's online and people that were doing title searches were in their offices doing them, and transactions were closing and people were buying new homes. And here in Vermont, that's not, as you all know, that's not the case. So there's things large and small that I think the pandemic will cause us to confront over the next few months and over the next few years as well.
So,
oh, sorry, Emilie, just quickly, and maybe I said this to you, Emilie, last show. I can't remember whose conversation it was, but I'm hoping one of the things that's going to come out of this experience is that because we have done things like house so many homeless people in hotels right now, or the Vermont Food Bank just announced the amount of dairy that was being donated to them to help hungry Vermonters, but also help dairy farmers. I'm hoping we're collecting some of the costs of this, because I'm wondering if we will get a new look at what it costs to fill in some of these cracks and find new ways of funding things. And maybe we will find that some things we thought were expensive to achieve, maybe they're not as expensive if we're going at them from a slightly different angle.
Yeah. And again, some things that some inefficiencies that maybe we just accepted in the past because we said, well, that's the way we've always done it. And, it's sort of, I don't want to tackle that thorny issue right now. I think it's making us confront that so that we can ensure that our dollars are being spent in ways that are most impactful for people in Vermont, right? I think that's going to be part of our challenge as well, is sort of maybe on the one hand overcoming some of these assumptions that it's too expensive and sort of saying, well, what does it really cost and what does it really, and can we afford it? But then also, are there certain things about our state or even our state government, right, that we should be thinking about doing differently to be making sure we're the most efficient we can be for Vermonters, and that their money can go to all of those things they want it to go to, like higher education and helping the less fortunate, and ensuring that all those programs that are critical across the state are well funded. So I think, I know Emilie, the legislature, certainly will have its hands full over the months and the years to come.
Mm-hmm. I think one great example of a system that many more people have eyes on right now, and has suffered from decades of underfunding and underinvestment, both sort of on the human scale as well as on the IT and financial scale, and that we're really now all seeing the desperate need for where really government can shine or could shine is the Department of Labor. And the incredible challenges that people are experiencing trying to access unemployment insurance. And so I want to start this off by saying, unprecedented levels of claims. Like a perfect system would be caught up in the incredible flood of claims and the incredible shift from, historically low unemployment to historically high unemployment.
Right.
And then we had a system that had been underfunded for decades through multiple administrations and political parties, and no one has ever thought it was sexy to spend millions of dollars on IT projects. Just like not a winning thing to campaign on. It might be now, but it was not before. And huge political gaffes in history over, IT projects, certainly. So all of that, we were actually just about to go out to bid on a new computer system for the Department of Labor, which, in 3 years probably would have helped this. But what I've seen through, and so it would have been hard at any time, but what I want to talk about is what could have made it easier to get through that difficulty. And before we got on air, I said that, I've always been really impressed with how well the Department of Financial Regulation functions, how empowered the staff there are to solve problems, how happy customers are even when they're being tightly regulated because of the respect that they receive from the folks that they're talking to. And so really just curious to unpack lessons learned about what makes bureaucracy work and what makes bureaucracy want to, have people slam their heads against walls. So yeah, curious, insights that you've had. I've certainly had some of my own that I'll jump in with.
Yeah. So, I kind of think one of the big ones is communication. And I think it's a two-way street, the communication, I think, and we all can do a better job of communicating. So I'm sure folks in my department will listen to this and think, boy, he should be taking his own medicine. But, we all can do a better job of communicating, but you need to be able to communicate what's going on to your team, and they need to sort of have a clear understanding of the game plan. So whether that's sort of the mission and the strategy of your department so that they can feel empowered to, execute. They also need to have, it also needs to be clear communication about, what is expected of them and what authority and ability and power that they have to sort of resolve issues as well. And that's sort of, sort of general sort of communication. But then in a crisis like this, certainly, you can't over communicate. So, making sure that you're informing your team and your staff of everything that you're working on so that they can focus on their work. They don't focus on the crisis. There's certain elements of the team that has to focus on the crisis, but it's really critical for them to be focused on their work. And I think the more you communicate about what we're doing to solve the crisis, the more they can focus on their work and not be worried about that other thing. So I think that's important. But like I just said, communication is really a two-way street. So you, as a department, as a leader, you have to be willing to engage in the communication back up to you as well, whether that's from a deputy or whether that's from a frontline staff person. And it's not obviously we all have emails. They can just send us an email. We're all open to communication in that way, but we all have to be open to taking time to appreciate what the person is saying and experiencing, and also take time to appreciate their perspective and be open to changing our own minds when we realize that, oh, I had this perception that this program would be rolled out in this way and it would solve this problem. And then when the person that's executing it tells us, this is actually the result, not this, you need to appreciate that and take it into account and change your own perspective.
There's
So
a lot of wisdom within an organization from the people who are working on the front lines of that organization. And there's also a lot of wisdom in the people who are experiencing that system, right? And
oh, for sure.
Mechanisms, I think the communication also goes sort of that next step out of the bureaucracy to the folks who are being served by the bureaucracy, being able to be communicated with in a way that they understand, which state government is terrible at. Again, throughout multiple administrations, and then being able to actually hear feedback from those folks is really difficult.
Hear it and digest it and be open to it. And even if it's, and people that are likely to give it to you are probably not people that are going to be quite pleasant when they give it to you.
No.
But you have to look, past that and understand what they're saying, right?
Mm-hmm.
But you're absolutely right. I mean, if we were to design here at the Department of Financial Regulation a banking program, right? We know more about banking than probably the average Vermonter. We would know more about the intricacies of it, the lingo, the language, and when we sort of put out the statement about how to use it, how to apply for it, how it would be effective, most people say, what are they talking about, right?
Mm-hmm.
So you're absolutely right. You need to think of how does an average person that's not expert, or even not just expert, but maybe totally new subject matter to them, how do you put yourself in their shoes? And I think the only way you can do it is by refining your systems over time and taking their feedback into account.
Mm-hmm.
One thing I think that has always stressed me out as someone who's had to access state systems sometimes is I feel like big decisions are being made, and yet I may not know how to speak the language of the person interpreting my information. And so I feel like any little mistake is going to get me tossed out, and then I have to start this complicated system over again.
Well, and not just a feeling, that's a reality.
It is okay, good. I'm glad it's not just in my head. And so I wish we had a better way to again, as Emilie said, collect people's experience, but also instead of like with, say, Vermont Health Connect, instead of denying whether or not you qualify, to have like a more gentler, gee, this didn't fit our parameters, but did you answer this correctly? So there's a better kind of like
absolutely
follow-up system.
A colleague who I have a very different political bent from, but who I really enjoy speaking with, we were talking about the Department of Labor and the challenges. And he said, the system is designed to minimize fraud, not to expedite payments. And what I've heard from constituents over and over again is that they're trying to fill out these forms that they've never filled out before, that are fairly opaque. They're terrified of answering a question wrong, just like you said, Olga. And then either they're thrown out because they misunderstood, or they're placed in this category of fraud risk. And they're told that they're a fraud risk when in fact, they are in a category of misunderstanding.
Right.
And so when we design sort of, the more ways we could go back in and be designing the systems so that they, spoke the language of people who are filling them out, I think the clearer it would be to really differentiate who is, where is the disconnection and where is the actual.
I think that's right. I mean, so, one thing we have done, and this is a limited universe, but the one thing we've done at our department, is engage in sort of stakeholder feedback. We've put out surveys, and just as recently as 18 months ago, if not a year ago, to our captive insurance industry, about 600 captive insurance companies, asking them, what is it that we do well in Vermont? What is it that we don't do so well? What is it that you want to see more of? What is it you want to see less of? What policies are impeding your, progress, or impeding your changing your interest in being in Vermont versus another jurisdiction? And whenever you engage in those self-reflection sort of efforts, it tells you something. And again, you have to be willing to change and listen to the feedback, because we all want to be defensive, and I think we want to be defensive because we all care so much. We all, and we're all saying, no, I have my right. I have it I'm doing what I think is right and best, and this is the way to do it. But that can be true, and you could also not be having the right approach at the same time.
Yeah, I think, people go to work for state government because they care about Vermonters. You certainly don't do it for like the money or glory. But when I think about what process improvement looks like in bureaucracy, you earlier was talking about sort of like minimizing the steps someone has to go through,
Right.
minimizing the number of people someone needs to talk to, how much can be automated so people can actually like have an easeful way through. And then, which sort of, some people call lean, and,
Right.
we're calling pivot for a while.
Right.
And then one of my favorite exercises to do with a team is to use Post-it notes, which I love more than most anything in the world. And I'm worried I'm going to run out of my stash before I'm up, social distancing measures.
I have so many, I'll drop some in your mailbox.
Thank you. But I like lots of different colors and shapes. But it's to actually ask folks who deliver services to go through a process where they map out the experience from the person who's receiving services perspective with Post-it notes. Like each time they need to have contact with someone, each step that needs to be taken, like every form that needs to be filled out, every new office they need to go to, like requires a brand new Post-it note so people can have like that visceral experience of like the step by step by step.
Yeah.
Great exercise.
It is, and it's a visual exercise, but it's also sort of a physical exercise as well, because you're sort of having to sort of physically write these down, put them and jot them out, and sort of create that process that is maybe, again, in our heads, but we need to sort of put it down on paper and put it out in front of us and see where the bottlenecks are, where the weaknesses are, where the confusion is, and try to improve on that.
Something else that both Mike and Emilie, you both touched on that just sort of will be my takeaway from the conversation is, when you were talking, Mike, about creating a banking system and what it would mean for the average Vermonter, and then Emilie, when you were talking about your conversation with your colleague, the system was designed to prevent fraud. I wonder if we need to get better at communicating to the people who are trying to use these systems what our expectations are, because if the person who's trying to access unemployment insurance has one expectation of why they're accessing this and what it's supposed to do for them, meanwhile whoever designed the system has a very different outcome in mind, that's just eventually going to lead to loggerheads.
And I think that gets to what you were saying, Mike, about the really being articulate about the mission and vision of an organization, right?
I think that's right. And of course, the mission has changed a little bit at DOL, and that probably creates the confusion as well, because it was designed for sort of fraud prevention or ensuring that the right people are getting the right benefits. And now it's sort of viewed as a safety. It's always been a safety net, but it's an expanded safety net whose intent is to sort of help get state money and federal money to people that need it as efficiently and quickly as possible, which is a very different mission than, being a safety net for those who need it in these specific circumstances, right? And those specific circumstances involved judgments and some involved evaluations of people's circumstances. Did they quit or were they fired? Had they previously committed fraud on the system? So all of these judgments that, are part of the previous mission, in some ways get tied up and confused as we try to get people relief and not worry so much about the reason that they're seeking relief and such.
Or the favorite one, did they quit because the employer wanted them to quit, but didn't want to actually fire them? Yeah.
And like, how, sexual harassment and other workplace issues get tied up in that is intense. We talk about unemployment insurance at dinner a lot lately. And
have you received a lot of constituent outreach on unemployment? I'm assuming it's
frustrating, heartbreaking, overwhelming. Like, it's just really, it's unbelievable. And every single legislator that I talk to has heard the same, like 50 things that have gone wrong with the system and has heard them multiple times. I haven't, it's been a long time since I heard a new terrible story. But for each person, the fear and frustration, spending months because, I guess it's weeks, spending many, many weeks, which, calling hundreds of times a day and not getting through, social security numbers not being recognized, just like things that are just, it must be horrifying.
So there's a good example though. The social security numbers not being recognized, as I understand. So we have about 20 people at DFR at our department that are assisting with DOL. They started about 3 weeks ago to help with with some of the challenges that they were having. And they just told me this week that, oftentimes many of the calls that they're getting are people who say, my social security number wasn't recognized. But in reality, it's just that the system was so busy, the system couldn't recognize and process their social security number. It's not that their social security number isn't in the system. It's not that it's wrong in the system.
It was just like overloaded.
So then they immediately
So
call,
stressful.
they pick up the phone and they call because they're like, what
Flood.
is this all about? Which is what I do. And you pick up the phone, you say, what's this all about? And then because the way that system communicated, it didn't say, for example, system is overloaded at this time, the demand is high, please try again at, after 7 p.m., when demand's lower. That could have avoided a phone call, but instead probably 90% of those folks are picking up the phone and calling and saying, what is this all about? And it takes time to sort of explain
And
that.
they're calling hundreds of times.
Yeah, right. Exactly.
Yeah.
So it's challenging.
So at dinner, my son asked more than once, as we're sort of, I'm explaining like the benefits and the layering and the extra $600 from the federal money and how that all works. And the percentages, and he's asked more than once, why is it less than someone made when they were working? And just can't quite get his head around that. And I was trying to I'm what is the logic of it? Because probably someone needs that same amount of money. Their life is probably built around the exact extent of their paycheck. That's true for almost all of us. And I was well, I guess there's an assumption that you would never go back to work, or people won't look for work, or people won't feel desperate enough to take the next step in their life if they are making their full paycheck on unemployment, even though it's a short-lived program, right? And that distrust of people, right, is really built into the foundation of the system. The desire for the little push towards desperation is built into the foundation of the system. And so moving beyond that in a time when we desperately want economic stability is difficult.
Yeah, for sure. And I'm sure you're absolutely right. We've talked a lot about paid family leave up in Montpelier, and whether it's paid family leave or disability insurance, usually the wage replacement is less than 100%. And it's for that exact reason that, the incentive is to try to obviously take care of folks when they need it, but then making sure they don't overuse the benefit, right? So when they don't need it anymore, they go back to what their circumstances were. So I'm sure that's the same logic in the unemployment circumstance. But again, the paradigm that we're looking at this all through has changed in the middle of a health and economic crisis.
And I hope we carry this paradigm into the future, because I think we've been in an economic crisis in this state and in this country for a long time.
For too long.
Olga, you've been trying to jump in and I haven't.
Well, unfortunately, I don't want to jump in, but we have gone way over time. So I should probably be a good host and just ask you both quickly, is there anything you wanted to add or wish we had touched on before we send you back into your evening? Mike, Emilie?
I'll just recall the last time we all got together was right before New Year's, I think, and we were on the cusp of 2020, and I know we were talking about New Year's plans and things of that nature, and I thought 2020 was going to be a lot better than it has been turning out. I'll just say that.
Yeah, doesn't 2019, December 2019, feel like a whole other lifetime ago? Not a few months ago.
Very much so. So I hope that now that we've come together and sort of this, we're through the first quarter of the year, that maybe, maybe the luck will change for the second half of 2020.
I hope so.
Me too.
Thanks.
Me too. Well, as always, listeners, thank you for tuning in here on WVEW LP Brattleboro, your community radio station 107.7 FM. Emilie, where can people find you?
EmilieKornheiser.org, eKornheiser@ledge.state.vt.us if it's a constituent challenge, eKornheiser@gmail.com if it's a political question. Fine line sometimes. I'll send you the right place if you go to the wrong one. Or you can find me on Facebook, Twitter, Instagram, and every Saturday morning at 9 a.m. I'm hosting a Zoom community conversation with reps Tolino and Burke, and folks can find that login information by contacting me any of the other ways I just mentioned.
Fantastic.
Great.
And Commissioner Pieciak, any resources you want to steer Vermonters towards right now in this time of COVID?
Yeah, for sure. So if they visit our website, dfr.vermont.gov, Vermont spelled out, we have a COVID resource page right on the middle of our website. It has information about all of the healthcare and health insurance related policies that we've implemented over the crisis, all the insurance and banking measures we've taken as well. And it also has all of our modeling that we've done to date, both the presentations and talks about the modeling partners we're working with and their interactive models that help inform our decision making. So I'd encourage people to visit that, both for the policy and to get a sense of the modeling as well.
Fantastic. Thank you. Emilie Kornheiser, Mike Pieciak, thank you for joining us today. Have a great weekend, everyone.